My name is Jamie Flores, and this is my informative speech assignment, and this will be my audience, my brother, my mother, and my sister recording.
Hey, my name's Jonathan.
I'm Dina.
Imagine what life would be like without a healthy set of teeth. Imagine you trying to chew your food properly, grind your food together, or even speaking, trying to make sounds like the sound or the sound without a healthy set of teeth. What first impression would you make on a first date? How would you feel about yourself? Good oral hygiene is very important. And as long as we can remember, we had people tell us all our lives how and why we should take care of our teeth. But how effectively are your good oral hygiene habits? My name is Jamie Flores. I'm a current student at AACC, and today I would like to inform you about good oral hygiene habits, and how to break bad ones. Okay, so let's begin. According to the author of the Encyclopedia of Dental and Oral Health, Rhinestone Carroll, oral hygiene is the preventive, provocative regimen designed to straighten the surface of the teeth, clean the mouth as to reduce the buildup of dental plaque, thus lowering the risk of dental decay and periodontal disease and tooth loss. Now let's see basic dental procedures. Let's go over those. Cleaning your teeth, flossing, cleaning your tongue, caring for your gums, massaging them as you brush. Now, exactly why do we do these procedures? Well, we're fighting against dental plaque. What is dental plaque? Dental plaque is the sticky, colorless film of bacteria that forms in the teeth. Tartar, also known as calculus, is caused by a continual accumulation of minerals from saliva and plaque on your teeth. Cavities. Dental cavities in the mouth is a disease that causes damage to the surface and structure of your tooth. Gingivitis is a very common and is a former mild of gum disease. And gum disease is the inflammation of the soft tissue, which is your gingiva, your gums, and it produces an abnormal loss of bone surrounding the teeth and that holds them together. Okay, so now that we've looked at the basic dental procedures and what we're fighting against, let's look at our bad oral hygiene habits. Now, a lot of the things that we do and do not do contribute to our good oral hygiene habits and our bad oral hygiene habits. So let's look at common oral hygiene habits. Not visiting your dentist regularly. You should see our dentist at least twice a year, every 6 months. And if you are a patient for periodontal or gum disease, you should see your dentist 4 times a year. So according to the Vital and Health Statistics Series 11, number 248, Trends in Oral Health Status, about 16% of children ages 6 and 19 and 23% of adults between the ages of 20 and 64 had untreated cavities. According to the Centers of Disease Control, roughly 78% of Americans have had at least one cavity by the age of 17. So that lets us see how it affects us for not seeing our dentist often. Our misconception, most of us think that because we've been brushing our teeth all our lives, that we know how to do it properly. And that could be the case in most of us. So, also, using the incorrect toothpaste. A lot of us don't use the toothpaste according to our needs. We can talk about a few of the different types of toothpaste that there is out there. There's a toothpaste specifically just for smokers. There's toothpaste specifically to whiten your teeth. There's toothpaste specifically for people with sensitive teeth. But the best thing to do is to see your doctor, and he will let you know the best toothpaste toothpaste for your mouth because he knows your mouth better than anybody else. Also, timing. Most of us don't brush our teeth for at least 2 minutes at a time. So if you brush your teeth 3 times a day, you should at least be brushing your teeth for 6 minutes throughout the whole day. Also, not eating healthy foods affect our health. Eating too many sweets or acidic foods can affect our good oral hygiene, keeping our teeth healthy. And last but not least is switching your toothbrush often. A lot of people don't know that they should switch their toothbrush at least every 3 to 4 months. So according to Roberto J. Walker, who wrote an article about fighting gingivitis and what you need to know about good oral health, 3 out of 4 patients don't change their toothbrush as often as recommended. Toothbrushes should be changed every 3 to 4 months. And if you have an illness in your mouth, you should change it more often. Well, let's pause and reflect. See how often do we fall into oral hygiene habits.
I give up.
Okay, well now we can transition in looking at how we can develop good oral hygiene habits. We should floss at least once a day. It helps remove the bits of food and dental plaque in places your toothbrush cannot find it. It also helps to keep your gums healthy. Brush your teeth after every meal, and if you're not able to brush your teeth, chew sugarless gum for at least about 20 minutes. Remember to clean your tongue every time that you brush your teeth, and also replace your toothbrush regularly. Okay, so now I'm going to demonstrate your basic toothbrush. You have your basic toothbrush, and you have your toothpaste, and you want to do about a quarter size, or no, about a dime size. And then when you brush your teeth, you want to angle it at a 45-degree angle and move it in circular motion as you move around your mouth. So I'm going to read basic instructions for brushing your teeth. On the outer and inner surfaces, brush your teeth at a 45-degree angle in a short half-tooth wide stroke against the gum line. And on the chewing surfaces, hold the brush flat back and forth. On the inside surfaces of the front teeth, brush vertically and use a gentle up and down stroke with the toe of the brush. Brush your tongue back and forth, in a sweeping motion, removing the food particles, and that would help you refreshen your mouth. Okay. Well, now that you learned the importance of good oral hygiene and what can happen if we fail to follow good oral hygiene, things, like cavities, bad breath, gingivitis, and other things that can lead to serious illnesses like periodontal disease. We also identified bad oral habits that we are guilty of and how to replace them with good ones. We can all benefit from being good to our teeth. It brings many benefits like saving money and not having to worry about toothaches or wearing embarrassing plaques and stuff like that. It will help our self-esteem. So, thank you very much.